Hi, so many of you, are you a pharmacist? Did you just leave school and maybe you have, chance to money, inheritance, loan, and you're thinking of opening your pharmacy? Because that's the it. If you don't own your pharmacy, if you are working for people, you will go through a lot of things. Your salary, go past, make I no talk. Go to my YouTube channel to watch salary scale for pharmacies. So how can you open a pharmacy in Nigeria? What are the rudiments? What are the steps? So this is going to be a YouTube video. Go to my YouTube section to watch the rest of the video. Number one, get a venue. You know that your pharmacy should be very close to the roadside, and you know that it must be, a little bit about 5 minutes walk, about 5 posts apart from the nearest pharmacy, because there are rules guiding it. That's why you don't see pharmacies all scattered. A pharmacy must be well distinct apart from each other. So you don't want to have pharmacy like block 1, block 2. No, it must be farther apart, except they are in front of an hospital. If a pharmacy is in front of an hospital, that's when they are licensed to, to be more than 2, 3, 4, 5 in front of. You can think of any federal hospital, you know what I'm saying. But except that, a pharmacy in a community area or a community pharmacy must be well apart from other pharmacies. So after you have gotten a venue, now what type of venue must you get? You must be able to get a pharmacy. Is a profession that is well organized. So when you are getting a venue for a pharmacy, there are things that must be there. Number one, it must be well ventilated. Number two, the pharmacy should have a toilet, because these are some of the things the PCN will come and check. The pharmacy should have a pharmacist office in it. So there are criteria. You should have a pharmacist office in the pharmacy. So it might not really be available as at the time you are getting it, but there are people that carve it out. You can carve it out with furniture, you can carve, but you should know that your pharmacy should contain the pharmacist office. So you also check for the size. And the size, I think for retail is about 30 square meters. I don't know, but there are guidelines. You can look it up. So once you are sure that, okay, when they come, they are going to approve this place, then you now call for inspection before you pay rent. And the reason is because we've had situation whereby you pay rent, and by the time you call PCN, they come and they tell you that it does not meet the standard of a pharmacy. Ogbeni, you collect your money back. You can't open a pharmacy in that place. So that's why it's always good to call for inspection before you pay rent. Because many of you are just thinking, how can I open a pharmacy? And you're a pharmacist. This is actually for a pharmacist. So after you have paid rent, then you now go back to the place. You still call them again for another inspection. That's inspection number 2. Because setting up a pharmacy is not just a joke. It's not a joke. So you call them again, inspection number 2, and when they come, this is when they will do interview for you. They will ask for your license, they will ask for other things, the NYC and stuff like that. So you wait for their feedback. So why is your license up to date? They ask for a lot of things, but they are just things that are ethical, things you should have. So while they are doing that, you can be arranging people for your chef. Chef varies. Some people 700,000, depending on how fancy you want your chef to be. Some people want glass chef. Some people want. Well, for me, I believe that if you are opening a pharmacy, it depends. This is not a glass chef. Are we selling here? Yes. So how many times have you got into a pharmacy and you say, no, I can't buy drug there because it's not a glass chef? How you arrange your shelf is what matters. How clean your pharmacy is what matters. How professional you are in how you treat your patient is what matters. It's not whether it's glass. Well, it's good. If you have the money for glass, you can. But for starters, just do something like this. Just do. But because even this, you'll still be spending up to 700, 800, depending on the number of chefs you want to do. So some people do their own chefs that even have lighting there. It depends on your purse. But for a starter, you just left school. You want to start small. Oga, cut your coat according to your size. So after they've given you your chefs, then you want to think of roller shutter. What is roller shutter? Roller shutter is all those things they used to put in shop after glass door, those iron. Why do you need it? We've had times whereby a pharmacy that contains provisions and all that, when you go, people come, they buckle the place. They steal machines, they steal provision, they steal the freezer and all. So just to be on the safer side, that's why you should do roller shutter. When we do ours, I think it's about 250 for 2 doors, 2 main double doors. That's about, I think, 500k. So that's that about that. Then another thing, you should now register. So you now apply for registration of premises. Of course, they have check inspection. Then during the second inspection, which was the inspection for registration, they will now give you a certificate for your registration. So then you can stock up. So now if you're asking me now, or if you want to book me, you can book me as a consultant for you if you want to open a pharmacy. The money I'm going to collect is not much, but I will run you through the whole process, and we follow up till your pharmacy is well settled. And I could even practice for a month for you. Free. So, but once your pharmacy is well set up, you have your pharmacy, and then you start using your facility. But it is very important that your pharmacy, you should have a policy cupboard there. Yes, this part of the things they will come and inspect. When you go to the PCN office, they are going to give you a poison book. It should be well registered. Then they will ask you, what literature do you have? When talking about literature, we are talking about BNF, MDES. We are not talking about codes, of course. It's not a pharmaceutical industry, but we are talking about, books, reference book that you can get dosages of medications, indications of medication, drug reactions, where you can get all those things. It is very important that you have literature by the time PCN is coming. When they were coming down in our own, in fact, we had to get literature. So, and it must be up to date. Get the recent MDES, BNF. MDES is even okay, but at least you have 2 to 3 literature. So that, because you cannot be a professional that doesn't consult. You should have an authority you consult, and most of the times always the books. This is always in the book. So that's how it works. So setting up a pharmacy in Nigeria is not really hard, but beyond what people think, you need a license. The way it is done is a pharmacy premises per one license. You can't use a license to open 3-4. If you are going to be opening 2 or more branches, you have to get another pharmacy to register those ones for you. So it's a license per premise. It's a license per premise. So that's how it's done. So if you have any other questions, my email is there. You can put it in the comment section. That's how to open a pharmacy. Steps in Nigeria. Well, must you be a pharmacist? Yeah, it's actually, the thing is that you should be a pharmacist. But we have people that are now non-pharmacists that still open pharmacies in Nigeria, but they get a pharmacy to do the registration. But who is going to be practicing there? That's it. Because when you give your license out for opening of a premises and you are not there, any misconduct in that premises goes to you, because when the authorities come, is the license on which that premises was registered that will be held responsible. It could be suspended. A lot of things could happen. So if you are registering a premise for anybody, make sure you are the pharmacist that is there. Okay, imagine registering a premises for somebody that is not a non-pharmacist, and they were doing all kinds of unprofessional thing there, and at the end of the day, caught up with the authority, they catch you. They have no business with the person that is there. He's not a pharmacist. He will go to jail, but he's not a pharmacist. Who registered the premises? That's it, under the law. So whose license was used? Like, that's how it works. So if you are registering a premises for somebody, you must ensure to the latter that they abide by the rules that governs the profession, so that they don't tarnish not only themselves, and they don't also tarnish your image. So I think that's all. If you have other questions, you can book for consultation. Thank you. That will be all. Subscribe to my YouTube channel and have a nice day. Shalom. Please understand that I was talking about a pharmacy, not chemist. Opening a chemist is another thing entirely. I'm going to be doing that later, but there are rules to open a chemist. But I'm talking about a pharmacy. Pharmacy is different from chemist. Please, let's understand the difference. Yeah.